Hello all, I am Dr. Walter from SNS College of Physiotherapy. Now, today we are going to see a new topic, that is leprosy. Okay, so leprosy was a great pandemic disease like we had in COVID. No, like COVID, leprosy was a pandemic disease. It was around 50 years plus back. Okay, so before that and all, leprosy was so pandemic that the people will not allow the leprosy patients inside their home, even though if they are belonging to the blood relation, their father or mother or anyone, they will not allow these people inside their home. So now we are going to see what is this leprosy and what and all factors which induce the leprosy and which and all countries which were affected with this leprosy. Now we are going to see the introduction for the leprosy. Leprosy is also known as the Hansen's disease, and it is caused by the bacterial condition, that is Mycobacterium leprae. So in our next slides we are going to see about the definition and all the trends. Okay, now definition for this leprosy. So what is the definition? So for examination purposes we need to write a proper definition, and this is the thing. It is an infectious disease characterized by the skin lesions, okay, and nerve damage. Okay, so what is this definition is meaning of? So if a patient is affected with leprosy, the skin will be going for a lesion type, and what is happening to the nerve? This nerve will be going for the damage, that is the sensory loss. So even if you are pouring a hot water, the patient cannot able to feel the hot. Okay, so this is a major last stage for the leprosy. Now going for the epidemiology and the global trends. So what is epidemiology? Now it primarily affects the impoverished regions with limited access to healthcare. As we said before in the starting of this video, this leprosy took back 50 plus years back. Okay, so in those days the healthcare segments for each and every area was very less. As of now we are having many hospitals, many multi-specialty, many clinics for each and every state, but those days it is very less. Even now in most areas like in Africa, in tribal areas and these types of areas, the healthcare professionals are very much less. Now, so according to the World Health Organizations, there are up to 2,02,000 new cases were reported. Okay, so on globally in 2019 it was taken by WHO. So this is the epidemiology, that is the current population for the leprosy patient. Now going for the next one is the clinical manifestations. It is present with the variety of clinical manifestation including skin lesion, peripheral neuropathy and muscle weakness. Diagnosis. It is deeply involved in the clinical examination. Properly for this diagnosis, physical examination is a must. Okay, then sensory examination and also the motor examination, and along with certain blood tests also needed to rule out the leprosy, and biopsy. In some cases the biopsy of the muscle and also the skin will be sent to the laboratories for the blood clarifications. Now community impact. So how this is getting affected for the community? Surrounded by the social significant stigma, and which is leading to the social isolation of the affected individuals. If a patient is getting this leprosy, the patient will be going for the isolated area as we did in the COVID-19. Okay, so same way this thing of isolating a patient or a person will be affecting their mental disorders. Now economic burden on the communities. What will happen? Economic burden, they cannot go to any other jobs, they cannot work, they cannot even go to other people's and to get some help, because this is a communicable disease. It will spread. So people will not allow these people, leprosy affected people. So the economical status of this patient will be very worst. Public health interventions. What is the role of the public health care sector? Now, so effective public interventions, dividing how many patients are there, and what is their source of income and all these things, what is the mode of treatment is given to these types of people, all these things will be calculated in this area, and the educational support will be also given to the patients, and the support and other things, services, social services to these people is very much important in the leprosy. Now, going for the conclusion, this leprosy remains as a significant public health issue despite advancement of the treatment. Now, this is a community medicine subject, and here we are going to go into the world and to treat the patients. If we are going to treat a leprosy patients, what is the mindset of our physiotherapists to treat the leprosy patient? So we need to be very careful, and other hand, we need to be very generous to these people. And this is how we are going for the conclusion, and hope you might have understood this topic. We'll meet in the next video. Thank you.